Thank you very much. Today I will talk about filling a gap. I call myself that I am a very typical social entrepreneur. I am just urging every fellow citizen in Ethiopia and in Africa as well to think about how they can fill the gap in every problem that we are facing currently. It can be in health, in politics, in peace and reconciliation, in agriculture, in every sector that we are working with. So I'm a social entrepreneur trying to fill a gap by a business model rather than a very typical aid. That is not sustainable. Let me briefly tell you about my story. My name is Kibret Abebe. I am the founder of the first private ambulance service system. An ambulance service system that is affordable, accessible, and quality. I am a nurse anesthetist by profession who work in big teaching and referral hospital in Addis Ababa called Black Line Hospital, conducting anesthesia, forcing to see almost every day the prevalence of road traffic injury in Ethiopia, really high. As per the book in 2000, there was 194 deaths per 10,000 licensed vehicles. You can compare this figure with Japan, for example. 0.5 deaths per 10,000 licensed vehicles. If people are expected to die with the number of cars, we are not expected to die. But those people who have a number of cars in their own country, like Ethiopia have only less than 1 million cars for 120 million. If you take this figure, Japanese have a lot of cars. Why we are dying with that? Because of our safety measure. So, as an anesthetist, I was having a number of cases that sustained car accident and coming to me or at outpatient department to be saved. I just asked a very simple question to my friends, fellow surgeons, anesthetists, and nurses. Who is expected to go to the scene or to come to the hospital? Is the patient or me? Very simple question, just seeing the gap. Is the patient who sustained an accident, who is not able to breathe, who tremendously bleed, is expected to come to me? Am I expected to wait for him in the hospital? Or it is me, a professional, expected to go there? So I tried to explore about this. And the emergency medical service system came to the picture after World War II. Those people in the war, especially Canadians and Americans, when they go back home, they didn't found an emergency response system that was available in the war front in their own respective home. They said that, how dare that we are missing this? And they found the first 911 response system. So I told to my friend that we can do it. So my fellow friends challenged me in two things. One, who are you, for that matter, to think about this big agenda? And the second challenge was like, for how many people that you save life? This is a big country. So I said to them, then where is my drop of contribution on the topic that I am really well versed? I am challenging every fellow citizen in Ethiopia and in Africa as well. Unless and otherwise, we think seriously about our drop of contribution on the topics that we are well versed, it will be very difficult to change the scenario of Africa and Ethiopia. So the name Tabbita means a drop. Tabbita means a drop in Amharic. That means we need to think our drop of contribution on the topics that we are well versed. So thinking this, took me like 17 years. To go back to the statistics, from the statistics that I told you, 194 days per 10,000 licensed vehicle, only 4% of them are coming to the hospital with ambulance. The rest, 96%, are coming with personal car and taxi without any life-saving measure. You can imagine. And life-saving is not the skill of every fellow citizen in this country. I am not sure how many of you in this room knows the number to dial about if we face any life-threatening condition. We need to have one figure in Ethiopia to dial so that the entire emergency medical service system of the country can be changed. So thinking this, I get a chance to evacuate one British citizen diplomat in 2007 from Addis Ababa to London. And I successfully evacuated him to London. I received a call in the morning. I was living in Black Line Hospital because I am an emergency person who need to be called very repeatedly. So one night I was having 5 operations and I was exhausted. I was just sleeping and a big surgeon called me and he told me that he need my hand to be evacuated this patient. So I evacuated him in the afternoon successfully after 8 hours flight from Addis Ababa to London. When I come back, a bit emotionally, I resigned from Black Line Hospital. I told to myself that I have seen how emergency medical service works in the affluent society. So nothing is impossible. I resigned from Black Line Hospital and I submitted my proposal. My proposal is sustaining life through integrated first aid skill training, first aid provision, and professional ambulance service in Addis Ababa. So the two important challenges that I faced at the very beginning is that they said, if you want to be like Red Cross without asking any money from the service that the service receiver is receiving, we can give you without any standard. But if you want to make money out of it, then we need a standard, and we don't have that standard. So I was forced to write 17-page standard for the country to implement my project. This is a picture of social enterprises. I told them that I don't want to have another begging basket. I want to have an entrepreneurship mindset that change my life, that create job opportunity, and that can potentially grow. So the concept of social entrepreneurship is that we may see a number of social problems. In Ethiopia, we only have like either non-profit or profit maximization. I am not interested in both of them. I am very much interested in a topic that make an impact and make a profit, that potentially give a better life for me, give an opportunity for job employment, and of course that potentially can grow. So the government was not happy about this, but I really fight. I'm a fighter. So this took like 6 months, and then they said, okay, after the standard, they gave me the first license. The second challenge that I faced was, I get the standard, and I want to be an entrepreneur. I want to invest. I want to take risk. So where is the money? So I try to lobby with 2-3 banks in Addis Ababa. Try to let them just to understand what I am trying to do. Then all of the banks refuse my proposal. They are clear with the impact, but they are not clear with money. So I sold my personal house. I fight with my family, my wife. I convinced her and sold my house, traveled to Dubai, cook second-hand car to ambulances, bring them to Addis Ababa. When I am in front of you, I am the happiest ever chap because my ambulances professionally and modestly grow from 3 to 15 ambulances. We evacuated more than 100,000 patients. We opened the first paramedic college. We start the first manufacturing company. And before I die, I want to have air ambulance service system and a trauma center. We always believe that we need to think big, start small, and act now. We are acting. Thank you very much.